Hi, everybody, and welcome back to the Code Blue Classroom. My name is Ashley, ER nurse and nurse educator. Thank you for being patient with me. It's been a hot minute since I've made a video. Mom life's been a little hectic, but I'm back with a good one today. So let's be totally honest here. You've got bills, burnout, and barely time to breathe some days. Should you really be spending $400 plus on a nursing certification? Let's break down the pros, the cons, and whether that fancy badge actually pays off. The content on the Code Blue Classroom is intended for educational and informational purposes only. While I am a licensed nurse and nurse educator, I am not providing medical advice, diagnosis, or treatment on this platform. Always follow your facility's policies, clinical judgment, and current evidence-based guidelines. The information shared here is not a substitute for professional training, institutional protocols, or medical direction. By watching and engaging with this content, you acknowledge that you're responsible for your own clinical decisions and professional practice. No provider, patient, or educator-student relationship is established. Any views expressed are my own and do not reflect those of any employer or institution. If you have a medical emergency, seek help from a qualified healthcare provider or call emergency services. So what is certification anyway? This goes beyond basic nursing licensure. This is voluntary and hones in on a specific specialty, skill, or practice area. So you'll see on here, I've got some pictures of some of the different certifications that you can get. Obtaining certification signifies and demonstrates expertise in a skill, specialty, or practice area. It's important to note that this is different from an advanced practice nurse, such as a CRNA, family nurse practitioner, AGNP, etc. These clinicians have advanced practice degrees, such as master's or doctorate degrees in nursing. So what are some examples of nursing certifications? You have your CNOR, certified perioperative nurse, certified oncology nurse, certified emergency nurse, certified critical care nurse. There's just so many choices, and you can see on here just a few of the badges that I was able to place on the slide. So the question is, why do we pursue certification? Other than prestige and ability to boast about your certification, what reasons do we have for becoming certified in our specialty? When we talk about professional growth, I'm taking it back to nursing school here for a second and the nursing theorists. If you recall back to nursing school, Patricia Benner had the nursing theory of novice to expert, which is personally one of my favorites. Advancing through the stages of novice to expert is a form of professional growth. Pursuing certification helps us to grow as nurses and within our practice specialty. As we expand our knowledge, we also progress through the stages of novice to expert. I don't know about you, but I feel that feeling confident at work has a way of bringing more joy into my job. What a better way to boost your confidence than studying for and passing a challenging exam in your specific area of expertise, right? Do you have aspirations to work in leadership or education or pursue advanced practice degrees? Then this could set you apart and catapult your career in a positive direction and definitely distinguish you from other candidates. Certification is a major boost for career advancement. What if your job not only recognized you for your certification, but sweetened the deal? Some institutions offer monetary benefits either annually or in dollars per hour, which I don't know about you, but that extra financial boost definitely sounds good. Some institutions even recognize certified nurses on clinical ladder programs, awarding them more recognition and potentially financial gains for their place on that clinical ladder. Additionally, clinical ladder recognition can also boost your career advancement as well, so it kind of goes back to that prior bullet point. So, what are the benefits to being certified in your specialty? First, there's credibility and respect. While some people can study and pass a test, there is a level of prestige that comes with specialty certification. So, not everyone is just getting this certification. We don't often see many healthcare professionals, especially nurses, who remain with one health system for 20 plus years anymore. Or if they do, they transfer positions within the same institution. Being certified gives you a more competitive edge, and you can snag that job you want over a non-certified counterpart. I will say you don't even necessarily need to be certified in the specialty you're going into. When you're certified, it shows a level of dedication, expertise, and drive that employers look for. So, for example, if you have your certified emergency nurse, but you're potentially going to look for a job in, say, an ICU, you don't necessarily need to be a certified critical care nurse, but having that CEN does show you that level of dedication, expertise, and drive that your employers are looking for. As I mentioned before, certification bonuses are financial plus. Who doesn't like a little bit of extra cash? There is a sense of accomplishment when you pass a certification exam. Magnet recognition, that gold standard in nursing excellence, and shared governance goals also look to have nurses obtain certifications. So, specifically, magnet institutions have decreased mortality and infection rates, improved nurse satisfaction, and overall improved patient care. I think it's fair to say there could be a correlation between all of that and those certified nurses. Certified nurses can correlate to improved outcomes, but are not the direct cause for the improvement. Getting certified in a specialty helps to improve patient care. When you better understand your patient population, it should not be surprising you can provide better care for them. Are you unsure if taking the exam is right for you? Are you unsure if you have the knowledge or readiness? Some institutions will put you through a review course to help you prepare and learn that new material. So, as with anything, there comes cons and some even challenges when facing taking a certification exam. So, first, the cost. Certification exams are not cheap. For example, according to the AACN website, CCRN certification exam can range from $255 for members to $377 for non-members. Average across all specialties range from approximately $250 to a max of about $400. That's a hefty amount of money to shell out of pocket. There is also a time commitment, a commitment to study, potentially take a prep course. That's additional time outside of your job to prepare, and many places of employment aren't going to pay you for that study time. Unfortunately, some institutions do not adjust salary or offer incentives for becoming certified, so this time and money commitment may not even be beneficial for you from your institution standpoint. Some jobs you apply for may not require it unless it's a magnet facility. So while it will set you apart, it isn't a requirement. So you may obtain a certification for clinical competence and bragging rights only. Definitely a challenge, but sometimes there are folks who are just good test takers. This means you can pass any test but not truly absorb the knowledge. Are you then applying this to real life and improving patient outcomes? Lastly, and unfortunately, if you do not pass the exam, you may owe your institution money if they paid for your voucher, or you're just out of the money that you spent on the exam. Regardless, precious dollars could be lost if you don't pass the test. So after weighing the pros and cons, is it really worth it? If you expected this video to make this decision for you, you're going to be sadly mistaken. You can make charts and diagrams and decide what works best for you. But here are some questions to reflect upon. Do you want to specialize or grow in leadership? Are you determined to lead? Perhaps you don't want to scale the healthcare ladder and get your MSN, but you'd like to be a charge nurse or other unit leader. Certification could definitely set you apart. Hey, if your employer reimburses you or offers you a bonus for passing the exam, then the financial gains could be worth it or not worth it, depending on the dollar amount. Are you passionate about your clinical area of expertise? Do you really love being insert your nursing specialty here? Then getting certified could be a pride point for you. Are you job hunting or will you be looking for a job soon? This could be what sets you apart from another candidate looking for the same position. So these are just some things to think about and reflect upon. So here are some tips and tricks. Before you get yourself anxious about taking another exam, first, ensure that your specialty offers a certification exam. Next, what requirements do you need to take the test? Some tests require you to have years or hours of experience prior to testing. Pro tip, before you register to take the exam, see what your institution offers. Do they reimburse you? Do they offer a review course? Make sure you're asking all the right questions. Lastly, there are loads of wonderful resources out there. Ask people on your unit who've taken certification exams how they studied and what materials they used. Read the reviews of the reference materials. Reviews can be helpful in determining if it's worth your money. So, lastly, I just want to share my certification story. I would be remiss if I didn't share that I am a certified nurse. I received my CEN in 2014 after having been an ER nurse for 2 years. I felt like it was a good time to take the test for me because prior to being an ER nurse, I worked in EMS. So my CEN was in 2014, and then I just recently passed my certified pediatric emergency nurse in 2025, and that was fueled from several things. Our emergency department takes care of adults and little kiddos, and I really felt like I just wanted to challenge myself in caring for my pediatric population, which we don't see a high volume, but we see enough that I wanted to provide better care. And also in 2024, I became a first time mom, so that changed my perspective on kids that I see in emergency settings. As a mom, it's so hard some days. And when your kid is sick or injured, you just want to be able to help them. And I think getting this helped provide a different perspective for me. And I just wanted to be knowledgeable and able to help my patients in a better way. So I got my CPN this year. I hope that you enjoyed my story. Certifications can be powerful tools if they align with your goals, timing, and your support system. Let me know in the comments below. Are you certified or are you thinking about becoming certified? Like, subscribe, and join me every week for some nursing brain boosts. As always, knowledge is your best code card. Stock it well. Bye, everybody.